People aren't like sitting there going like, I want to heal my circadian rhythm. They want to know, what does that tangibly get them in their lives? So talk to us about, what does this mean when you balance your circadian rhythm?
So when the light comes through our eyes and we're able to sort of start making some improvements or some changes to the kind of light we wake up with and the kind of light we experience in the evening, we can see tremendous improvements to the quality and the quantity of sleep that we get. That's number one. So people that are struggling with sleep, they know how much of a problem it is. It is very important for our mental health and our physical health. The other aspect of that light coming into our eyes is that it does have implications for mood regulation or mental health. Anxiety, depression, and seasonal affective disorder have been studied immensely with tremendously positive benefits with red light therapy. So I think those are the most commonly talked about. Some people will talk now about different metabolism regulation centered around blood sugar and insulin levels, but I think sleep and mood are the two big ones. But if you live on the internet, you would see that red light therapy is everywhere and it's coming through people's skin. So I think we just nailed red light therapy through your eyes. Red light wavelengths, both red and near infrared. When we say red light therapy, that's like a blanket term. It has a ton of fancy names, but red light therapy is intended to mean both the red wavelengths from the sun and the near infrared wavelengths from the sun. And for your YouTube people, you will see that when I turn off the red wavelength on this machine, it's actually still going. Near infrared wavelengths we can't see. They don't produce any visual color that our eyes can perceive, but they are absorbed by our skin along with red wavelengths. So red light therapy is basically the use of red and near infrared wavelengths to be absorbed through our eyes and through our skin. The skin implications are very much so fascinating and really effective. So pain and inflammation is a big one. Red and near infrared light comes into our skin. It's actually absorbed by some structures in our cells called mitochondria. They produce the energy for the cells. So that applies to pretty much all the cells in our body. It could be skin, it could be fat, it could be hair, it could be bone, it could be ligament, tissue, muscle, blood, organs. Any cells that can produce energy more effectively are going to work better and have a ton of health benefits. So pain and inflammation is people using red light. They can use it close to their skin for skin absorption. It actually goes anywhere from 4 to 8 millimeters under the skin level down to the tissue, and it can have a scattering effect systemically even. So it's used very commonly for, injuries, chronic pain, acute pain. People use it for recovery from activity, but you will see an immense benefit in using either a panel or a wrap with red light therapy to reduce pain and inflammation. It literally feels amazing. That near infrared wavelength can produce a little bit of warmth to it that's really soothing as well. So the experience is good, but it's actually the light that generates the effect. So pain and inflammation, performance and recovery are two big categories. We already talked about sleep and mood, but then there's this category that I feel like people are like, it's too good to be true, which is anti-aging, hair growth, and fat loss. And red light therapy is a class 2 FDA approved device for fine lines and wrinkles, collagen production, and fat loss. So there's enough scientific studies that show increased collagen production with regular use of red light on your skin, age spots, fine lines, skin texture. It's used for all the things that we all want, and it's safe, which is really amazing, because to me that contradicts what we've been told about the sun for so long.
Well, we also got completely manipulated and lied to. by the sunscreen industry. And it's so effing ironic at this point, because it's like, now we know that the oxybenzoates and like all that's what's causing the skin cancer. Okay. Okay. Now, I mean, that said, of course, you don't want to go out and get roasted, but still.
When we talk about this in some of our courses, we do present some fascinating studies that look at people living near the equator who've never used sunscreen in their lives. They don't have skin cancer. They don't have any skin cancer. And they are the epitome of what our culture would say is unhealthy, which is a dark, very tanned skin. So skin health is big. It's safe.